Hello and welcome to Dr. JB's Sleep Series, Clip 3. In this episode, let's talk about sleep deprivation. The biological world we belong to is thrilling, just absolutely thrilling. My first impression of our present day sleep scenario is that we are a sleep-deprived society. Now, that may be a bold statement to make, I understand, but sleep deprivation is what I see in a lot of people around me. Sleep deprivation? What is sleep deprivation? What is the big deal? Sleep deprivation, in simple terms, is when you don't get the sleep you need because you are deprived of the time and the ambience, the environment conducive to sleep. I am pretty sure you heard of the terminology insomnia. There are probably groups called insomnia. There are restaurants named insomnia as well as products called insomnia. Now, by definition, by diagnostic criteria, insomnia is difficulty falling asleep, staying asleep, or non-restorative sleep. Okay, so this difficulty is present despite adequate opportunity and circumstance to sleep. This impairment in sleep is associated with daytime impairment or distress, and this sleep difficulty occurs at least 3 times per week and has been a problem for at least a month. Now, this is the diagnostic criteria of insomnia. Okay, so we have insomnia and we have sleep deprivation, both around the same corner because both involve failing to get enough sleep. Now, experts in sleep science make a distinction between these two, that is, a distinction between insomnia and sleep deprivation, and this is important because people with insomnia have trouble sleeping even when they have plenty of time to sleep. On the other hand, people with sleep deprivation don't have enough time allocated for sleep as a result of behavior choices or everyday obligations. Now, I'm sure this will make it very clear to you as to why sleep deprivation has to be addressed, because this is a behavioral choice or behavioral pattern. So, sleep deprivation, you don't get enough sleep. So you do not have a sleep disorder that prevents you from getting enough sleep or causes poor quality sleep. It's just that you don't get enough time or the right place, the ambience to put you to sleep or the right environment to put you to sleep. Sleep deprivation is estimated to affect around 1/3 of American adults, a problem that has only worsened in recent years. And this is pretty much, I think, the scenario all over the world. And not only adults, it is our children, the adolescents, who are having this huge challenge with sleep deprivation. Now, this is very interesting. I'm sure you heard of a company called Fitbit, the makers of activity trackers and wearables. Now, they conducted a survey between the 1st of August 2018 and the 31st of July 2019. So a year, pretty good time to collect enough data. And they published this information, or they released this information on several online platforms. And they collected data from wearables from 18 countries, starting from India, Argentina, Canada, Australia, Chile, France, Germany, Hong Kong, Ireland, Italy, Japan, Mexico, New Zealand, Peru, Singapore, Spain, the UK, and the US. That's a tall order of a list, rather, of countries. Now, I don't have the data for all the different countries and what information they got out of it. When I get the data, I will publish it here. Now, they reported that Japan is the most sleep-deprived nation globally, as an average Japanese gets only 6 hours and 47 minutes of sleep. And India is the second most sleep deprived country with an average sleep of 7 hours and 1 minute. So the sleep deprivation is a huge problem, and we need to take this seriously. I remember reading an interview published in a publication called Business Line in 2020, Feb of 2020, and the cardiologist who was interviewed, quoted, "A large number of young patients have had a heart attack or a stroke or have been diagnosed with diabetes, hypertension, or even cancer." Now, many factors may lead to such diseases, as we all know that, but sleep deprivation is one that is least talked of. I cannot agree more with this cardiologist. This is a real issue. So how much sleep do we need, you may ask? And here is a table which has been used pretty much all over the web based on data published in a reputed sleep institute. Now, what they've done is I've only taken two of these columns here, which is a recommended column and maybe appropriate column. So depending on one's age, the number of hours of sleep that we need may vary. So newborns 0 to 3 months of age need 14 to 17 hours of sleep, infants 12 to 15 hours, toddlers 11 to 14 hours, preschoolers 10 to 13 hours, school-aged children, that is the children between 6 and 13 years of age, 9 to 11 hours, teenagers 8 to 10 hours, young adults 18 to 25 years old 7 to 9 hours, adults 7 to 8 hours, and older children 7 to 8 hours. Older adults 7 to 8 hours. Now, do we see people getting these many hours of sleep on a regular basis? Teenagers 14 to 17 years old, teenagers getting 8 to 10 hours of sleep? That's pretty tall. That's pretty challenging, isn't it? Now, there's another column also provided here which says that, even if you get certain hours of flexibility, fewer hours here and a few more hours, for example, young adults 6 hours to 10 to 11 hours may be appropriate, but I'm not a big fan of this may be appropriate column because it gives us an excuse of not getting enough sleep or oversleeping. So, what are the consequences of sleep deprivation? Sleep deprivation can cause challenges in the central nervous system, the brain, increased irritability, cognitive impairment. Cognitive is something that is related to or being involved in conscious intellectual activity like thinking or reasoning out things or remembering things, as well as memory lapses or loss of memory, impaired judgment through the day, decreased creativity. Now that can be big. Increased stress, which is we already stressed, that could even increase it more, and that's not something that we would want to have. Constant yawning, especially when you're talking to someone at work. Constant inability to focus or concentrate, and in some cases hallucinations through the day. Sleep deprivation can cause challenges with the musculoskeletal system. There's impaired reaction time, decreased accuracy while working on something because of muscle challenge, tremors, fine tremors of the hands, for example, aches in muscles, accident prone probably because of an increased reaction time while driving or riding a motorbike, and as well as decreased accuracy. So it certainly is a challenge. Sleep deprivation can affect the gastrointestinal system, the GI system. It can impair the immune system directly because the largest immune system in the body is called GALT, gut-associated lymphoid tissue. Okay. We can have digestive or digestion issues. We can have acidity. We can have something called the leaky gut, which leads to infections around the body. One of the issues here is sleep deprivation works on the bacteria and the viruses, or what we call as a gut flora, that we need so badly to be working well. So an impairment in the gut flora can cause a lot more challenges than what's been listed over here. Sleep deprivation affects the endocrine system. Insulin resistance syndrome, which we know more popularly as diabetes, but diabetes is only a small part of insulin resistance syndrome. We end up with obesity or weight challenges, growth suppression, increased appetite because of hormones like ghrelin, which increases appetite. Obesity because of challenges with another hormone called as leptin, which is secreted by fat cells. Growth suppression can happen because growth hormone is basically released maximally during the first half of the day. So sleep deprivation can affect that as well. Sleep deprivation can affect the cardiovascular system. So one can have a heart attack. One can end up with a stroke. People have hypertension or blood pressure, both related to impaired eating habits because of sleep deprivation, as well as changes in something we call as sympathetic activation. There is also another condition called as heart rate variability, and when that gets impaired, it really affects or challenges the cardiovascular system. Sleep deprivation can increase the risk of cancers. There's increased inflammation which affects pretty much every part of the body. Inflammation seems to be the undercurrent of most of the what we call as chronic diseases like diabetes, like Alzheimer's disease. There is an increased risk of getting infections when you are sleep deprived. There is a deliberate attempt being made towards, increasing the awareness amongst policymakers and the public regarding sleep deprivation and its consequences. So it is happening, but even if that is happening, we have to take it very seriously and change a lot of things that we do in order for us to get good sleep. And this movement of towards improving sleep or getting rid of sleep deprivation doesn't happen at an individual space. It has to happen from the societal space, the social space. Everybody has to be talking about sleep deprivation so that we can fix it. Here are a few personal tips from me to address sleep deprivation. One has to meticulously plan sleep hours. So discuss your requirements with family and people at work. They have to know what the challenge is. Get up and go to bed at the same time every day. This helps with training your brain to reprogram itself. So sleep challenge will not get fixed overnight. The brain can be trained. Optimize your sleep environment. Keep the room dark. Minimize noises. Maintain a comfortable room temperature. These are very, very important. Refrain from watching TV, watching your telephone, a tablet or a computer before attempting to sleep, because the light and the blue light that is emitted from many of these devices tell your brain that it is daylight, and trying to sleep just after that will just confuse the brain. So leave a gap of at least an hour. Read a book with the right light instead of watching TV or a telephone or a tablet. Try not to take your worries and responsibilities to bed. Do not watch the clock. Minimize napping during the day. Refrain from heavy exercise at least 2 hours before bed. That certainly will help. Have a light meal before you sleep. I really don't think that we should be eating lots before sleeping because there's a lot of inactivity happening at that time. Stay away from caffeine, nicotine, and alcohol at least 4 to 6 hours before sleep. Caffeine especially. Coffee is an absolutely fantastic drink according to me, but it can affect or shave off hours of good quality sleep. So be careful with that. If you have any medical issues, of course, that is interrupting your sleep time or quality of sleep, consult your doctor. So let me bring back this table that I had presented some time back. If you are a preschooler, 10 to 13 hours of sleep. School-aged children, 9 to 11 hours of sleep. Teenagers, 8 to 10 hours. Young adults, 7 to 9 hours. Adults, 7 to 8 hours. And older adults, 7 to 8 hours. So please keep this in mind. Thank you.